Good morning, everyone. We're going to start our press conference in about 10 seconds to give our media partners time to get in and situated. Good morning, everyone. We are going to start our good morning. Thank you, everyone, for joining us for the City of Lubbock COVID-19 news conference. Today we'll be getting the latest developments on the coronavirus in Lubbock. We have an update for the county, and officials from our local hospitals will give some insight into inpatient data and overall preparedness, and we'll follow everything up with media questions. Today's panelists are Director of Public Health, Catherine Wells, Local Health Authority, Dr. Ron Cook, Regional Chief Executive of Covenant Health, Richard Parks, President and CEO of University Medical Center, Mark Funderburk, Lubbock County Judge Curtis Parrish, and Lubbock Mayor Dan Pope. So let's start with Catherine Wells.
Good morning. I appreciate the opportunity to brief our residents on our most recent COVID-19 case results. Yesterday, Lubbock had our second largest spike in daily reported coronavirus cases. These spikes are in part due to the additional testing, but we're also seeing more COVID-19 or coronavirus circulating in our community. Please remember to stay home unless you have an essential need to leave the house, and also continue to practice social distancing. At this time, please allow me to update you on our current COVID-19 statistics and the outbreaks at our nursing homes and long-term care facilities. Through Wednesday, the health department is reporting 367 positive COVID-19 residents in Lubbock County. We continue to see more testing, and new sites are coming on each week. And we're very excited about seeing all of that new testing capability. As the epidemic progresses, more people are listed within the recovered category. As of yesterday, 89 individuals are considered recovered. And Lacey, if you can bring up the graph that shows us who's recovering and by age, we're definitely seeing more of our younger age groups recovering. We're seeing more and more of our younger age groups recovering. And those who recover quickly tend to be younger and overall in better health. The health department is also reporting individuals who sadly have died from the virus. To date, 25 Lubbock residents have died, and the youngest death was someone in their 50s. The majority of our deaths are with our elderly, and the nursing home outbreaks in the community are deeply concerning. Residents in our nursing homes live in close quarters, which makes social distancing difficult. The health department is currently working with two nursing home facilities who have significant outbreaks in our community. These outbreaks are challenging because once the virus becomes established in a facility, it is very difficult to control. The department also continues to focus on contact tracing and follow up with cases. This part is key to lowering the amount of disease or disease spread in our community. This is a very intensive process and require a lot of manpower. And we are currently training more staff to assist with this contact tracing, and that is to help us prepare for the possibility of more cases. This concludes our health department update, and I'm going to go ahead and pass this over to Dr. Cook. Thank you.
Thank you, Catherine, and I appreciate the opportunity to speak to our citizens. Let me just commend our citizens for doing such a good job. From what I've seen, when I go out into the grocery store, I see lots of people wearing their facial coverings or their masks. Please continue to do that. Please make sure that you're keeping your distance from other people. Make sure that you're washing your hands and covering your cough. And please stay home if you don't need to be out. If you're ill, please get tested. Now, one special group I want to talk to today, and that's our younger citizens in Lubbock. And although they may not all be listening, I know that several adults of our younger citizens are listening. please encourage them to wear their facial coverings when they're out. And when they're out running errands, perhaps they're running errands for you or for grandparents. The other thing I want them to realize is the fact that they may be what we call asymptomatic carriers. In other words, they don't know they have the symptoms or don't know that they have the virus because they don't have any symptoms. They may be blaming it on all the plants that are blooming right now. It's certainly allergy season. And so they may have the little sniffles or the runny nose, an itchy throat, a dry cough, which may be blamed on allergies. However, they could be carrying the virus and shedding the virus. The one thing I want you to hear today is that virus ain't got legs. The virus only gets to somebody else from your legs carrying it to somebody else. And it could be our younger citizens that are carrying it out, running errands for their grandparents, and then shedding that virus to somebody else that may be more susceptible. Individuals with lung disease and heart disease and diabetes, or maybe in our other patient populations that are much, much older. So make sure that our younger our younger citizens are wearing masks, are washing their hands, are covering their cough, staying away from people, keeping that social distance. And the last thing I want you to hear is virus ain't got legs. It only uses your legs to get to somebody else. Please don't stop social distancing. We're still about 2 weeks behind the larger cities. We're doing a good job. Let's continue to press on and do this good job because virus ain't got legs. That's all that I have. Lacey, back to you.
Thank you, Dr. Cook. Now we're going to go to our officials from our local hospitals. I'm going to ask them to start their video back. We are joined by Richard Parks of Covenant and Mark Funderburg of UMC. Can y'all start your videos? Okay, and we'll start with Mr. Parks from Covenant. Mr. Parks, can you unmute yourself? I'm having trouble unmuting you. There you go.
Okay. Can you hear me now?
Yes, sir.
Okay, very good. Thank you. Good morning, everybody. Just give you a few metrics from the Covenant Health System standpoint and a few narrative comments. First, I would say since we've started the coronavirus here in Lubbock County, we've had a cumulative total of 34 inpatients across our different ministries here in the region. As far as this morning, we had 13 total number of COVID patients, 6 of which are in our ICUs. We've seen I would say about a 25 to 30% increase in the average length of stay for these types of patients over our patients that are non-COVID. The average length of stay for a medical surgical patient is 6.3 days, and the average length of stay for our ICUs is about 7.8 days. As far as the testing goes out in the community at our 4 different fever clinics and the drive-through facilities for the community, we've had an accumulation of 1,157 tests, and we've had 115 positive tests. Obviously, we're testing our physicians as well. And on just some qualitative information, I would share that our personal protective equipment, or PPE, as you hear in the news, is improving weekly. We're satisfied with the amounts that we have now, and our testing capabilities and availability increases each week. I did want to say on a very personal and thankful note that we very much appreciate in the Covenant Health family the community support that we've received. It's just been superb. We've had everything from different PPEs being constructed in the community and given to our facilities and our staff and physicians. We've had food trucks that have offered their services. We've taken advantage of that. We've had people that offer childcare services out in the community, at no cost to our staff, which is really remarkable. And we've even had companies like recreational vehicle companies offer to provide care settings for any positive tested caregivers, although we have not had to use those types of facilities. But I did want to, in a very special way, again, thank the community for the excellent response and overwhelming support we've had as we try to take care of our community neighbors. Thank you very much.
Okay, and now we'll move on to Mr. Funderburg from UMC.
Okay, can you hear me?
Yes, sir.
Can you hear me?
Yes, sir. Are you watching on a monitor? You might need to turn your monitor down. Mute the monitor. It might work.
Unmute it. Can you hear me now?
Yes.
Yes? Can you hear me? Okay. All righty. Well,
Sir, is there any way to pick up the phone? It's getting too much feedback.
yeah, how about if I hang up and try again?
Try that. Okay, and while we wait for UMC to come back, I'll send it to Judge Curtis Parrish for an update from the county.
Well, thank you, Lacey. And first of all, thank you. And I would never pretend to speak for the good folks at UMC, but just let me say, while they get kind of their technical issues taken care of, how absolute proud we are of the folks at UMC, how they are working with our community, because their focus is not just Lubbock and Lubbock County. Their focus continues to be the entire region. Just as Covenant and with Mr. Marks. I'm telling you, we are so fortunate here in Lubbock to have such great healthcare providers with our hospitals. I think it is mostly because of that we are seeing such success that we're having here in Lubbock in combating this crisis. And although we are see areas that we're successful, there's areas that always give us concern. You've heard about our nursing homes, and you've seen the numbers over the past 3 or 4 weeks coming in about our nursing homes. And that continues to concern us. We have nursing homes not only just in the city, but in the whole county and in our entire West Texas region that we're constantly watching over to make sure that those residents stay safe and those who are caring for them also stay safe. I've also seen some very good things happening in our county as well. I've seen neighbors helping neighbors, folks that know that there is a sick person in their home, and I've seen neighborhoods come together to minister to them. I've seen churches who are no longer able to worship within their 4 walls take the church outside the 4 walls. I've seen our faith-based organizations, our civic organizations stepping up and not only ministering to their neighbors, but ministering to our hospitals as well. As Ms. Parks pointed out, the community is stepping up to help. And this is exactly what we expect in West Texas. Neighbors helping neighbors. And that is happening. And it is a wonderful thing to behold. And it is what will get us through this entire crisis situation. Are we concerned? You bet. We're seeing numbers. I know that we have some increases in our rural communities. And as those increases happen, we will be isolating those to make sure we don't see these outbreaks that we see in some of our larger urban areas. So they're still of great concern to us. And so we're encouraging everyone, please continue with your social distancing. Please continue. If you feel sick, if you are feeling feverish, you're having this dry cough, we've got mobile units that you can go to get yourself tested. Our hospitals are incredible. And here in the next week, we're going to have an announcement for an increased area where you can go and get tested. These are exciting times, but they're also very fearful times. And so we want to make sure that everybody stays safe during this. We're also very concerned about our businesses. And so in the next couple of weeks, we will be coming up with a plan in order to get our businesses back in business. Things will be different. We will be doing business a little bit different than we used to. But it is vitally important that we get our economy back to a place where we can all be comfortable and we can get people back to work, get our schools back operational again. I know summer times are usually kind of a slow time around West Texas anyway because of schools being out. And so we want to make sure that come August, when our schools are ready to go back in the business of educating our kids, educating our college students, that we do so in a very safe manner. The last thing we want, folks, the last thing we want is to get this current crisis under control, get everything down to a place where we feel comfortable that we're not having large outbreaks, and then we relax, and then we get more outbreaks. The worst thing that can happen is we get too comfortable. So we want to encourage everybody, continue with your social distancing, continue to wash your hands, continue to do those diligent things that we're asking you to do to please keep our community spread down. Please watch over our old ones. This is hitting our nursing homes very hard right now. And that's personally very concerning to me. My mother's in a nursing home. My mother-in-law is in a nursing home here in Lubbock. And so, and I've not been able to hug my mom in about 3.5 weeks now. And that's very concerning to me. But what's more concerning is I want to make sure that they are safe. I want to make sure that your moms and your dads are safe in our nursing homes. So let's continue our diligent effort in making sure that we keep this curve that we're on right now, keep it flattened. Listen to Dr. Cook, listen to Catherine Wells, listen to Dr. Mike Reagan, listen to Dr. Doug Klepper. These are the folks that know. They're West Texas people, and they know how to fight this the West Texas way. So I want to thank not only the mayor, but I also want to thank all of our rural county judges, those in Hockley County, Terry County, Hale County, Dawson County, all of our folks who are experiencing this crisis in their own way. I want to say thank you to them, and that we here in Lubbock County are ready to help you as we go through this crisis together. And now at this time, I'd like to introduce to you my friend, Dan Pope. Mayor has been working very tirelessly to make sure that we are ahead of this game, to make sure that not only are we keeping our community safe, but we're also taking care of the people who are not sick, because that's also vitally important to us, to balance that between caring for the sick of our community and caring for those to make sure they don't get sick. Mayor Dan Pope has been out front of this. I'm honored to call him my friend. And Mayor Pope, I'll turn this back over to you.
Thank you, Judge. I appreciate those comments. Lacey, before I begin, were we able to get UMC on the line? If so, I'd prefer to let them go and I would go last.
Yes, we have them dialed in.
Yeah, this is Mark. Can you hear me?
Yes, I can.
All right, great. Well, thank you very much. I appreciate the time, and I apologize for the error. I think we're having a problem with Zoom here at the hospital. I want to join Richard and start with some gratitude to our employees and medical staff and to those in city leadership for tremendous work thus far. I'm joined today by Mike Reagan, my CMO. I want to cover just real briefly our response, our statistics, our challenges, and our plans. Our response began with the COVID-19 drive-up clinic right out here in front of the hospital. It has screened just over 4,500 cars, tested about 2,800 folks. Dr. Barker and Glenn Frick have done a really phenomenal job presenting that to the community. The UMC COVID-19 call center has received around 4,600 phone calls, just 240 yesterday alone. We have nurses standing by in the call center, and really they are just reporting results, calming individuals, talking people off the ceiling, so to speak, if they're worried and anxious, answering their concerns. Our response now is to stop the spread. That's why we implemented 0 visitors in the hospital with very little exception. Most of the public has been very, very gracious to us regarding the 0 visitor period. Our statistics today are we have tested just over 2,700. We've detected over 300 positive cases in-house today, 18. 10 of those are med-surg, 8 of those are ICU. Under investigation, we have 12 additional. And so far, we've had 8 deaths and a total of 19 discharges from COVID diagnosis from the hospital. Our challenges today are essentially around PPE. We do have PPE, but we are learning something very important through this process. Buying is not the same as receiving. We have bought a great deal. We have not received everything that we have purchased. So PPE is still a challenge for us, particularly isolation gowns and gloves. We have it, but we need more. And we're leaving no stone unturned to make sure we get what we need. As far as our plans moving forward, the final conclusion of my presentation, our plans moving forward really are made up in 2 particular goals. The first one is ready, and the next one is retain. And what do I mean by retain and ready? Number one, we want to retain our staff, doing whatever we can to ensure their work hours are retained, to keep them working. We have redeployed staff. We have not furloughed anybody. We have redeployed staff to clinics, to the entryways as screeners, to our child care operation at Miller Elementary. We're training nurses to turn and to return to the bedside should additional beds be needed. If redeployment is not available and there's no time off left for that individual, we have a rescue program to guarantee a base compensation to our employees. Now that's about being ready, or about retaining our staff. Being ready means ready for a surge of COVID. And I know there's a great deal of conversation about the likelihood and the veracity of a surge, but nonetheless, our mantra, honestly, during this entire crisis has been firm, not fearful, meaning we want to be firm in our resolve to do everything possible, but not fearful while we're doing it. So in that regard, as we get ready, we are expanding bed capacity by 27%. We are turning outpatient areas into ICU beds. We are adding potentially 133 additional beds, and we are training 172 nurses ready to come back on board and to be redeployed should the surge take place. So in conclusion, I believe in the topic of the day, community spread, we are depending on the community to be vigilant. Otherwise, the hospital worker is really fighting with one arm tied behind his back, so to speak. So we must retain them as safe and ready to go to work. And so that's my conclusion. I appreciate your time today, and I'll turn it back over to Lacey.
Thank you, Mr. Funderburk. And now we'll hear from Lubbock Mayor Dan Hope.
Thanks, Lacey. Good afternoon. Good morning. I guess it's still morning. I have 4 things I want to say very quickly today. First of all, I want to start by thanking our hospitals, our health systems. They're really more than just hospitals. I'm thankful for Covenant and UMC for their leadership, for the men and women who give care, provide care in those hospitals. We brag about them at good times and we rely on them in difficult times. And I echo the comments that Judge Parrish made a bit earlier, and we're so thankful for them. Second, I want to talk a bit about community spread. On the 1st of April, we had 22 cases that we had identified that had contracted coronavirus via community spread. In other words, we couldn't find a contact to another case, a travel case. They're not in healthcare. That doubled in the period between the 1st of April and the 8th of April. So a week that went to 48 cases. Over the last week, we've only seen that grow by 10 cases. That's good news. That is one way, just one way, to measure our efforts, the success of our efforts to distance ourselves socially and stay home and stay safe. We'll continue to look at this and talk about this number, but I think it's important that that be pointed out. Two more things. The Lubbock Economic Recovery Task Force. We first talked about this Tuesday evening in our council meeting. Later today, I will be making further announcements about this, including the leadership of this group. They will meet on Monday. We are looking forward to more guidance from the governor tomorrow, but we will bring this group together. And remember, this group will be a group of community leaders. It will include businesses that are impacted by what's happened in the last month. It will include restaurants. It will include the financial sector. It'll be a broad-based group who is to give the very best advice to the city council as to how we move forward in a efficient and safe way. As I said Tuesday, it's about balancing lives and livelihoods. So please stand by for news on that. Before I wrap on that, I must say I've been blown away by the number of people who have volunteered to help out. It goes without saying that not everyone's going to get a chance to serve, but I'm thankful for our community stepping up. And that's where I want to end. I want to end by saying thank you. I want to thank those of you who continue to lead the way, who've adapted your behaviors, who are finding a way to keep yourself safe, and by doing so, keeping your family safe, your neighbors safe, and everybody in our community safe. It is about staying the course. It is about being patient. Remember that being stir crazy is not alone a strategy or a reason to have us reopen everything in our community. We will follow the good advice of our public health pros, our hospitals, the governor, the president, and importantly, our local recovery task force. I'll wrap with this. Remember the big three: wash your hands, don't touch your face, keep your distance. Be safe, be kind, and be hopeful. Back to you, Lacey.
Thank you, Mayor. We're now going to open it up for some media questions. So if all of our panelists would start their videos. Here is the order of media questioning today. We're going to have El Editor, KMAC, TTU Public Media, KLBK, Fox 34, Latino Lubbock, the Daily Toreador, the Avalanche Journal, and KCBD. So first we will start with El Editor.
Good
Olga?
morning. Good morning. Can you hear me?
Yes, ma'am.
All right. This is El Editor newspaper, Olga Agüero, the publisher. Good morning to all. And first of all, everyone's effort toward the health and the safety of Lubbock is so appreciated, not overlooked by no means. Gracias. The first question is, would it be helpful for essential businesses would be told or asked what is the possibility of temperature screening before entering or to wear a mask? Whoever's going to answer that, and then I've got a follow-up, a short follow-up.
I'm happy to answer that. It's Dr. Cook. I certainly think that that would be very reasonable to do if we were to go that way. I don't think we're ready to do that yet. I don't think we know exactly where we're going with the virus. But if we were to open up certainly having everybody's temperature checked as they came in, and certainly at a minimum, my personal preference would be to have everybody wear a mask, a facial covering of some kind.
Thank you. Number two, on community cases, how are those being investigated after being recognized? Are all those involved with the case being tested, being in quarantine, etc.? With this being asked, just wondering if this would increase the pending number of cases more higher than what they are right now.
I'll go ahead and take that one. The process for when we identify an individual that's tested positive for COVID, we do what's called a contact investigation. That means that we interview that individual to find out where they worked, where they've been in the community, who's in their household. Anybody that's been in close contact with that individual, so most likely someone living in the same household, will be quarantined for up to 14 days. And we will call them every couple of days to monitor for symptoms and make sure that they're doing okay. If they develop symptoms, we will work with them to get them tested.
Thank you.
Our next question is from Lauren Motter with KMAG.
Good morning. You guys hear me okay?
Yes, ma'am.
Thank you so much for taking my question. You kind of already mentioned a little bit, Dr. Cook, but we're talking about the importance of face masks. A number of cities and counties in Texas, the latest being Austin, has kind of made it mandatory for anyone who's out and about, 10 years or older, have that face mask in public. Is that something the city would potentially do, and would that allow some businesses to safely open sooner rather than later?
That would be my recommendation, Lauren. If we do go down the road and say we can open up other businesses, I'm going to let the mayor take care of that kind of response. But my recommendation to him would probably be to have some kind of facial covering. And I would even say below the age of 10 as well. So.
Okay. Our next question is Casey Ellingson from Texas Tech University Public Media.
Can you guys hear me? Sorry. Okay, perfect. So I was wondering if you guys could elaborate on your plans for opening up businesses, or if it's too early to elaborate on that.
Yeah, it's too early to elaborate on that. Our task force hasn't met. We're under a local and a state order to stay home, stay safe through April 30th. And nothing has changed in that regard. And we'll advise people as we get ready to reopen. But as I said, being stir crazy or being impatient is not a reason to use the governor's words earlier this week, to storm the gates when it comes to reopening. It needs to be reasonable and responsible. It needs to be done with safety. And that's, I think, how I believe we can strike that balance.
Okay. And I do have a follow-up question. Does the city have any plans in place for unsheltered homeless people?
We're still counting on our partners that serve the homeless community. They've been very active through this effort, whether it be Open Door, Salvation Army, or Paul's Project, Grace Campus. We had several different names, but they continue to operate. We continue to work with them. They've worked closely with our health department, and Ms. Wills may be able to add a little bit to that, but there's no change in what we're doing, but they continue to be an important part of our overall response.
And I'll just follow up on that. We've had multiple conversations with individuals in the homeless community, or that work with the homeless community, both with the health department and community development. And we're really just monitoring the situation with the disease and our disease counts and information.
Okay, our next question is Terry Furman from KLBK. Sherry, are you there?
Yeah. Oh, there we go. Now can you hear me?
Yes.
Okay, sorry about that. So in the last report, we have seen that healthcare workers, the number was about 17. Can you break down like who this is? Is this EMS? Are these nurses, doctors, just healthcare providers that work in offices? Where are we on those? And how do we plan to move forward, making sure that we try to keep that number as low as possible?
I think that'd be a great question for our both hospitals to weigh in on. Why don't we start with Mr. Parks, and then we'll go to Mr. Funderburk.
I believe my video is not coming on because Lacey, it says the host won't allow my video to come on, but I believe can you hear me? I believe
Yes, and we can see you.
Okay, very good. I would say that the caregivers that have contracted COVID for Covenant Health System have either all recovered or on their path to recovery. So thankfully, we've had no major issues there. We are doing universal masking. We also have various requirements for our staff when they're obviously doing surgical procedures or diagnostic imaging procedures. Same for our clinic staff. And we're thankful that our caregivers have been so aggressive in trying to protect not only themselves, but also the patients and the family members that they're dealing with. So thankfully, it's been an extremely low number for our health system.
And this is Mark Funderburk. I can add to that, please. To answer the question, we have had a mixture of clinical and non-clinical folks that have been diagnosed with COVID. They are not in the hospital currently, but we have had folks that have been diagnosed. It's been a small number, and we're very grateful for that. Really, the main gist of this is how do we keep that from spreading any further? And a couple of things in particular to keep our staff safe. We do have dedicated COVID units. We have tried to make that absolutely clear here at the hospital, both current units and contingency units should the surge continue and grow further. So there is dedicated units. Also, just a vigilance regarding temperature checking and proper PPE. We have folks in the units actually watching people don and doff their equipment to make sure they are doing it correctly. So there's even monitoring of that. In addition, we are making sure we have training going on for folks that are back to the bedside to make sure they're doing it correctly. So it's just an overall general vigilance of making sure the PPE is adequate and ready and appropriately applied and donned and doffed as well. But mostly that and the dedicated units, I think, really are our mainstay as far as at this point, being able to stop the spread, particularly for our employees.
Our next question is Blair Sable from Fox 34.
Hi, can you hear me?
Yes.
Hi, good afternoon, all. So my first question is just gonna be for Dr. Cook. You mentioned that Lubbock is about 2 weeks behind the larger cities. Can you elaborate a little bit more on that?
Well, our first case of COVID was in March, St. Patrick's Day, March 17th. And so New York City had their first case on March the 1st. And so that puts us 17 days behind New York City. Now, our demographics are a bit different than New York City. We don't have near the patient or the population density that New York does. We're a little more spread out here, which is very favorable for us. But we are still concerned about the spread and the surge that may be coming. But we're prepared for that. And so we just, it's up to every citizen in Lubbock and the surrounding communities to make sure that we're washing our hands and keeping our social distance and wearing our face masks if you're out in public to stop this virus, and make sure you especially stay away from those individuals that that are potentially more susceptible to the bad outcomes of the disease. And those, we've talked about those patient populations, the diabetics, the heart disease, et cetera. And so just please be vigilant. And so we're just waiting and watching, and hopefully our numbers will continue to plateau. We're hopeful, and but if everybody does their job, we can get through this. I have no doubt.
Yeah, and just a quick follow-up question for you again. Do you think we're nearing any sort of peak at all?
Well, only time will tell. We hope so, but only time will tell. We'll just have to wait and see. You know, the other thing that we need to do, and it's coming, is the ability to test more and more people. So we can find those, test people that aren't even having any symptoms. And what you do there is you find those people that are positive for the virus, and you isolate those individuals so they can't infect anybody else. But we have to have enough tests to be able to do that. Right now, we're still testing mainly those people that are symptomatic. And so that's obvious, we isolate those, but we need to be able to test anybody and everybody that wants a test and needs a test that may or may not be symptomatic, so we can isolate those individuals so they're not spreading the virus to somebody else. That's the ultimate goal.
Our next question is Christy Martinez Garcia from Latino Lubbock.
Good afternoon, everybody. First of all, I would be remiss not to thank the hospitals and what a great job they've been doing with testing. But on Monday, Dr. Cook announced if someone didn't have the means to pay for their testing, that there was help. The fee for the COVID-19 testing continues to be a concern for some individuals and some populations in the community. Please first provide a direct number for those who need that testing and can't afford it or don't have insurance, because they're getting many mixed messages.
This is Catherine, and we've heard a lot that all of the testing should be free, and we've reached out to our state and federal partners for answers to that question. They have both indicated that the cost for all COVID testing would be covered, and once we get clarification from them, we will make an announcement to the public.
Okay. I know folks are being charged $95 and some of them can't afford that, but my next question is, more than 1/4 of the private sector workers don't have access to paid sick days, and Latino workers are most likely not to have any paid sick days and are working front lines. They seem to be receiving mixed messages and being told to stay home if they're sick, but then they're getting fired or written up. So what can they do, or who can they be directed to, so that they can get some assistance with this? Because we're dealing with, we're getting a lot of phone calls from folks like that.
Christy, this is Dan Pope. I think our messaging has been clear about essential and non-essential. We've defined who those businesses are. We've worked very closely with those essential businesses to make sure that they are taking adequate safety precautions. My advice to a worker would be that if they don't feel like they're being treated in a way that where their environment is safe, they can choose to stay home. But I think the vast majority of our workers, our employers have stepped up. And if a worker has a question, we encourage them to call the health department and talk through it with our pros at the health department. And Catherine, I've just gone blank on your phone number, so I'm going to let you share it, maybe add on to that answer.
The health department phone number is 775-2933. And then the health department's also been working very closely with community development, and for families that have been under quarantine, that have had some kind of need. That group has been working to get food boxes and hook them up with different types of assistance, whether that's through a church group or a nonprofit here in town. So definitely reach out to the health department, and that's a good first place to start.
Okay, our next question is from the Daily Toreador, Adon Rubio.
Hello, everyone. I guess just for my first question is regarding just the surge in cases. Now, if there were a surge in hospitalized COVID cases, what are some contingency plans in place for that?
I'll be happy to start answering that if I can. This is Mark Funderburk again. Yes, sir. We have a surge capacity plan. Essentially, you're taking an inventory of all the beds you have in your hospital or things that perhaps could be a hospital bed, units, et cetera, departments, and then you are expanding that to take into account every possible space that could be a med surge or ICU bed. So in doing that, we're looking at about 27% surge capacity, and that's adding right at 133 beds. 121 would be ICU beds, 12 would be med surge. Of course, we're heavy on ICU, but that person in that bed could also accommodate a med surge, so it would go both ways. And that would be essentially taking into account areas of the hospital that perhaps at this point had been some other purpose, such as your post-anesthesia care unit would become an ICU. You choose those units because those are already mechanically vented and they're ready for those types of patients and that type of equipment. The next piece of that would be getting your nurses ready, and you don't have a bolus of nurses just unemployed. Therefore, you redeploy people who've been pulled away from the bedside over the years to do certain functions. And so you bring them back. We're working with the State Board of Nursing to make sure we do that correctly, training the nurses both online and in the units themselves to be ready to take care of a med surge or an ICU patient, even if they had not done that for a while. And then the last piece of that, of course, would be the medical staff. And Dr. Reagan has worked with our medical staff here and with Texas Tech to make sure we have adequate, responsible specialists and subspecialists in each of the ICU areas, both current and in the contingency. And then lastly, of course, as we started the conversation, which is PPE, making sure we have enough supplies for that. So those four areas really are what has been the gist of the main part of our expansion plan here in the hospital.
So this is Richard Parks with Covenant Health System. We actually had the benefit of doing some demand forecasting for our system, for all of our facilities. And each of our ministries, I won't go over each one individually, each of our ministries has a surge plan with the number of capacity of not only medical surgical beds, but ICU beds that they could expand. We also, as Mark mentioned with his medical staff, we've also had a contingency plan with all of our physicians by specialty. We know exactly who can come in. We know when they're going on vacation, what their plans are. We also have worked with our clinic staff to expand the number of people that are in our clinics. And we also have contacted the former nursing staff that we feel would be critical, particularly for ICU beds. And currently we have over 70 of those staff that would come back and work with Covenant Health System at our various ministries and hospitals across the region. So I feel as though we've done proper planning, but we'll keep doing that because we know that things could change. Thank you.
Lacey, I'd like to add on to that and just say that both UMC and Covenant have shared those surge plans with the city. We've shared them with our emergency management folks. We've had those plans in place for a period of time. Those are not brand new. And we feel very comfortable about the planning that has been done in our community. By the way, we also would rely, they didn't talk about it, but Covenant would rely on Grace Clinic and what they have. And the UMC part of their plan is potentially to use Heart Hospital. And so we would utilize other resources in our community to help if we needed to do that.
And Mayor, just to point out also is that these hospitals just don't serve the city of Lubbock and the county of Lubbock. They serve the entire West Texas region. So it's not just a matter of looking at what the city's needs or the county's needs are, but we need to look at what the West Texas needs are. And that's what I'm very thankful to UMC and thankful to Covenant for looking outside of our own borders and looking at the entire region and making sure that we're providing adequate health care for all of us in West Texas.
All right, I guess just as a follow-up question, and this is more in regards to the economic recovery task force. Since they're probably going to act as a voice for the community, is there any way that members of the community can get in contact with members of the task force to pose any questions or concerns?
Yes, that's a good question. Part of our effort will include a web portal, a web page, so citizens can post their concerns, their ideas, questions, whatever it may be. So yes, that's been thought about, and we'll announce that very quickly.
Okay, our next question is from Matt Dotre from the Avalanche Journal.
Hey everyone, Mayor Pope. It just seems funny to talk about, you know, plans for a surge and then also talk about opening up things in May. I mean, how realistic do you think that is to actually start opening businesses in early May?
I do agree with you, Matt, that it seems to not balance very well. We've got, I think, probably 80% of our effort is on the safety side right now, continuing to do the things to keep our community safe. But I believe that it's prudent and that we begin thinking about how we reopen. We've got people that are very much hurting. We've got small businesses and families that are hemorrhaging, and we've got to listen to them and start planning for their livelihoods and a safe way to reopen while we continue to keep our community safe.
And then another question for Mr. Funderburk, I think. You said PPE equipment is still a need. Like, at what point does that need become serious if nothing changes?
That's a great question. At this point, it's not serious. It really would depend on the surge of patients. If the patients continue to come and the PPE does not continue to come, it will become serious. But at this point, that is not the case. Yes, our allocation has been reduced. It's been reduced, I think, all across the state, and certainly in Lubbock, each individual system has been reduced. But the allocation is still there. It's coming in. I think what we're having to do, honestly, is just buy from several to receive from a few. And we're buying from many, many to receive from a few. So at this point, it's not serious. If it were to become serious, you know, you simply become innovative. And if you can't be innovative, then you start denying patients. And that's what I don't want to do. So that's really no different than if I didn't have a particular service or was on diversion or something. You would simply deny. But in this case, it's not serious yet. I think we'll be innovative. And what I mean by that is, for instance, right now, some of the masks are being reprocessed. Well, they're being reprocessed here in the hospital, but also Texas Tech has an operation where they're reprocessing N95 masks, which are the ones, of course, we need. And so with that being said, there is a way perhaps, and then you've got a resurgence of Tyvek suits that really take the place of isolation gowns, but they are a little bit weightier and heavier, a little more expensive, but nonetheless, they're available. And so I believe things that perhaps we would not have thought of being the norm are now part of the new norm. And whatever we do, honestly, we are using the experts in infectious disease, et cetera, here at the Health Science Center and Medical School to make sure we're making those choices correctly.
Okay, our next question is from Karen McKay, KCBD.
Can you hear me?
Yes, ma'am.
Yes, ma'am.
I appreciate Richard Parks and Mark Funderburk for giving us the total number of tests and then the number of the positive from those. It makes sense now that Covenant has the rapid testing that we're going to have a lot more people coming in for that test. So what I'm wondering is, are you testing these daily for a percentage? The percentage comes out so far from what UMC and Covenant gave us, about 10% are positive. The concern is going to be, compared to the whole number that are tested, if that percentage goes up, say one day from 10% and the next day it's like 20% of those tested are positive, then we're going to see a real concern. But right now we're not getting that breakdown, so we don't really know how it's fluctuating or if we're always just about 10%, which is the norm for positive cases compared to total tests. Do you understand? And I'm not sure who would answer that. But the question really is, are you testing that specifically every day to know how many more positives are going up in connection with the total number of tests that day?
Karen, let me start on this one, and then I can if Richard and Mark want to add, that'd be great. We follow the numbers, and we follow them every day. One challenge you have with just one day's worth of test is it's probably not a statistically valid sample. But if you look at now, we're north of 3,500 tests done in Lubbock County. Our number of positives, our percent of positives in Lubbock County for that number of tests is very much in line, in fact, nearly identical with the statewide average. And so that's something that we watch closely. Dr. Cook, Ms. Wells, Judge Parrish, and I, along with city leadership, are part of a public health call every day where we get inside these numbers. And so if we saw a spike, we would certainly report it, but it would be borne out in the numbers that we are reporting.
This is
for Catherine. Can I ask you, Catherine Wells, another question? We've talked about the nursing home exposure a lot, and we've mentioned specifically Whisperwood, Heritage Oaks, Lakeside, and Ivy House, but you're obviously still investigating a lot of possible cases. Are there other nursing homes that you can mention are also included this where you suspect exposure with the people who work there or the residents?
The two places that we really have under investigation is the Whisperwood and then also the number of cases at Lakeside. All the other nursing homes or assisted livings that we've gone into when they've had a positive case or a positive employee, we've gone in and done testing and haven't found any disease spread. And that's what we're really looking for, is we don't want to allow any virus transmission to occur inside a facility. Because once that starts happening, that's when it's difficult to control it.
Okay, that concludes our media questions and our press conference. I want to thank our panelists all for joining us today. We will have another one of these on Monday morning at 11:30, and that will include the latest information from over the weekend. Please follow the City of Lubbock social media sites for all the latest information coming out throughout the day, and hope y'all have a good day.